As the Zambia Flying Doctor Service, this year celebrates 60 years of transforming healthcare delivery. Looking ahead to the rest of 2025 with a renewed commitment to innovation, accessibility, and impact. The foundation, laid over the past 6 decades, is propelling the service into a future where healthcare knows no boundaries. In 2024, the Zambia Flying Doctor Service conducted 29 specialized medical outreaches, offering critical services to rural communities. In 2025, the aim is to increase this number to 50, leveraging our newly acquired helicopters to ferry patients and surgical specialists to camps like Nganga Bilonda Hospital in Mwansabombwe. These helicopters, which have added to the current fleet, will not only enhance accessibility, but also ensure faster, safer transportation for both patients and medical professionals.
Today, we received the first ever helicopter, one of the 2 that we have procured.
This will enable them to fly to all those far-flung places, strengthen the capacity to respond to medical emergencies, particularly in rural areas where there are no airstrips.
So this helicopter has come at a good time.
Let me salute His Excellency, the President, Mr. Hakainde Hichilema, and the United Party for National Development, UPND government, for his efforts ensuring that the Zambia Flying Doctor Service through the Ministry of Health are not left in the national development agenda. His unwavering commitment to improving healthcare in Zambia and his visionary leadership has made this milestone possible.
This is a good example of what can be done.
1, 2, 3.
Together, we are making tangible difference in the lives of Zambians by ensuring access to timely and effective health care, especially in the most remote and underserved parts of our nation.
With the full operationalization of Nganga Bilonda Hospital, Zambia Flying Doctor Service will introduce advanced surgical services, emergency care, and maternal health support.
That hospital is a complete replica of Chifu Level 1 hospital.
State-of-the-art hospitals, the one which was opened in Chifu, modern equipment, state-of-the-art hospital in Chamori, state-of-the-art hospital in Chimwemwe, in Chirabombe, and we'll have one in Kwanamkuku. And we're having the first ever cancer hospital.
Cancer hospital coming in Chichele or Kwanamkuku constituency. So we've got 2 major facilities which will cater for Northwestern Province, will cater for Northern Province, will cater for Luapula and the entire Copacabana.
For the first time in our province.
That is a huge step for us.
This hospital will serve as a model for delivering specialized care in rural settings, ensuring that no one is left behind.
We are using that one now as a surgical site. Where we go now in the far-flung areas, now that we are even getting helicopters, we'll be flying in the far-flung areas of Luapula, Northern Province, and Muchinga provinces, pick the patients, take them to Nganga Bilonda Hospital, because it is a hospital that has got all the facilities. All the theaters are there. The only thing that is missing are the what? The doctors. So we'll be transporting doctors from here, we'll be transporting doctors from UTH, we'll be transporting doctors from the Cancer Disease Hospital, from the National Heart Hospital, everywhere where we've got specialists, we'll be transporting them. We go and camp them at Nganga Bilonda Hospital for a period of 10 or 15 days. We transport patients there, patients are treated, and we take them back. Apart from that, We are going to continue providing primary health services at no cost at all. And that one I would want it to be very, very clear.
I think that statistics speak for themselves. Zambia Flying Doctor Service, established way back in 1967. And many, many years later, in 2025, we're talking about the first ever helicopter to be purchased for the Zambia Flying Doctor Service. Isn't this a milestone?
In 2025, Zambia Flying Doctor Service will revolutionize emergency response services by introducing a tech-driven application for ambulance requests. This app will enable communities to access help quickly and efficiently, reducing response times and saving more lives. Drones will also be deployed to deliver essential medical supplies to hard-to-reach areas, ensuring that even the most remote communities have access to critical resources.
So first line is the caravan. Second line is the helicopter. But beyond the helicopter, we are able to launch a drone and deliver that pint of blood that is required.
To achieve these ambitious goals, Zambia Flying Doctor Service is expanding its capacity through investments in staff training, advanced medical equipment, and partnerships. Collaborations with organizations like UK Charities, Prison Fellowship, and the Workers' Compensation Fund Control Board will continue to play a vital role in our success.
I Care for Zambia is a UK-based charity which was started way back in 2015. We offer free eye services to people of Zambia, and we make annual trips every year. We go to Zambia to do these charitable works. And this year, 2024, we partnered with the Zambia Flying Doctors Services, and we worked in Mwansabombwe. It was a great partnership. We are looking forward to signing the Memorandum of Understanding so we can work together. They are doing such a tremendous work, especially in rural areas where many other institutions cannot reach.
By signing an MOU with the Workers' Compensation, all health service provision under Workers' Compensation are now under the Zambia Flying Doctor Service. The arrival of this helicopter, every patient for the Workers' Compensation, wherever they are across the country, we are going to access them and provide the much needed services. We ensured in the year 2024 that we collaborated with all our traditional leaders. What else did we do? Because during traditional ceremonies, all the rural dwellers gather, most of them in one place. It's an opportunity for us to provide health services. So we ensured that in the year 2024, at least we visited 8 major traditional ceremonies.
By scaling specialized outreach, operationalizing state-of-the-art facilities, and integrating modern technology, the service is building a resilient healthcare system for Zambia.
Transformation does not start one day, Honorable Minister. We've seen that Flying Doctor Services has come also to end employment in this province, and we've seen that a lot of people have been employed.
Turn this place, Zambia Flying Doctor Service, in 3 years to where it is now. I think it was Dr.
Obviously, in terms of vision, we want to be a reliable and most preferred aeromedical service provider, contributing to sustainable quality health for all Zambians. I always say that a life in the rural area is as important as the life here in town.
I would like to thank Zambia Flying Doctor Services for their achievement in adding an helicopter to their fleet.
If we had committed CEOs, committed employees, directors, all the workers at Zambia Flying Doctor Services, in all the institutions, this country will never be the same again.
This is impressive, and I want to congratulate the leadership here, the leadership, the management, the staff, the team, all of them, multidisciplinary skills as they are, because we are all interdependent for the job well done, and also the Ministry of Health for pushing the revival of Flying Doctor Service.
Ladies and gentlemen, allow me to say Flying Doctor Service is back in the Champions League. I thank you.